So today we are talking about trauma and stressor-related disorders. It's chapter 12 in your text. And this chapter used to be what was called child maltreatment and non-accidental trauma. So that gives you a little bit of a sense of what we're actually going to be talking about. The new title really reflects the renaming process of the DSM. So DSM-5, this is what the chapter is in the DSM, trauma and stressor-related disorders. But the chapter still focuses on child maltreatment to a large extent. I also just had that moment of realization of when I was last at my office, I actually retrieved my DSM and then I forgot to bring it today for filming. So it's at home. You guys have seen it in discussion. I have featured it, but that's kind of funny. I'm like, I have the DSM now. Not with me today. Sorry. Happens. Okay. So let's start out, as we often do, with some definitions, make sure we're all on the same page about stuff. When we're talking about traumatic events specifically, we're talking about exposure to actual or threatened harm or fear of death or injury. And typically, traumatic events are considered uncommon or extreme stressors. Okay, so we're really talking about more than, oh my God, I forgot to study for a midterm. That's not a traumatic event. I mean, it sometimes feels like one, particularly if you're a really keen student, but when we're talking about traumatic events, we're really talking about things that may have caused death or serious injury, not forgetting to study for an exam. That would be more of a stressful event, so a more common and less extreme event than a traumatic event. Okay, and I actually just want to take a moment here to, okay, yeah, so we're going to focus first on the events, specifically maltreatment, and then the diagnoses, as the events often lead to diagnoses. So I should have said that first, oopsies. But again, it's really important for us to discriminate. In our everyday language, we probably overuse the term trauma. We say things like, oh, that was so traumatic, when maybe what we should have been saying is that was so dramatic, or that was so stressful. When we're talking clinically about trauma, we are talking about things that could potentially lead to us being seriously injured, dying, fear of dying, or watching someone else die is also a possibility. In terms of the disorders, so again, trauma and stressor-related disorders is a new category in DSM-5, and what it includes is acute stress disorder, adjustment disorders, post-traumatic stress disorder, PTSD, reactive attachment disorder, and disinhibited social engagement disorder. Our main focus disorder-wise will be PTSD, but we will touch on the others as well. And so again, PTSD and acute stress disorder used to be in the anxiety disorders category. There are similarities, but we also recognize some of the differences in them, and adjustment disorders fit better with the trauma and stressor-related disorders, as well as reactive attachment and disinhibited social engagement disorder. So, but we're going to start again with maltreatment, and then we're going to move on to the diagnoses. So here we go. When we're talking about child maltreatment, it's actually a fairly generic term that refers to 4 primary acts: physical abuse, neglect, sexual abuse, and psychological abuse. Okay. Maltreatment comes in many forms, and it cuts across social, economic, racial, and cultural lines. So that's one thing that we have to keep in mind, is that we actually see that these 4 acts, so physical abuse, neglect, sexual abuse, psychological abuse, will happen to children regardless of where they live, how much money their parents make, whether their housing is secure or not, whether they're white or they're Black, Indigenous, or another person of color, whether they're male or female, whether they identify as heterosexual or homosexual, whether they identify as the gender assigned to them at birth, or whether they identify as transgender. Children across all walks of life, across all geographical regions, across every strata of the socioeconomic world will encounter child maltreatment. sadly. 1 in 10 children will experience sexual victimization. 1 in 10 children will receive harsh physical punishment, and about 1/3 of these children will develop a diagnosis, okay, related to this. So, this is problematic. Children are particularly vulnerable as the abuser is often a caregiver, which also complicates the child's reaction. When your parent provides you with love and comfort and security, but also beats you senseless when you come home having failed an exam, what do you do? Because you love them and they clearly love you, but they've also hurt you. And that's really confusing for a child. When an older male relative says to you, this is going to be our little secret. It's really important you don't tell anybody, but you're really beautiful or you're really handsome. And I really love you in a way that's different than the way anybody else loves you. And so now I'm going to touch you. I'm going to fondle your genitals. Maybe I'm going to penetrate you with either a finger or with a penis. Maybe it'll be vaginal, maybe it'll be anal. But don't tell anyone, because I love you so very much and you're so special to me. And here's a present. And you're like, wait, what? Right? So it can be really confusing for children to know how to react, because oftentimes it's a parent, it's a caregiver, whether it could be a daycare staff member, a teacher, a nanny, right, a babysitter. It can be a relative, someone who they love and they trust, who then does something really hurtful. I know for myself, not having experienced this, I want to just caveat that, but my mother has 2 older brothers, and they were very much involved in mine and my brother's life. We saw them weekly, if not multiple times a week. The thought of if either of them had ever tried anything, I would have been really confused, because they were good guys. They were funny. They did fun stuff with us. They were around all the time. They looked out for my mom, who was their little sister, right? So it's really confusing for children, and that's one of the reasons that children often don't disclose, because they also don't know, if mom can hurt me so badly, or dad could hurt me so badly, or aunt or uncle or babysitter, who do I tell? If I tell another one of my caregivers, will they protect the abuser or will they protect me? Do they know that this is happening? So it's really, really confusing for kids, and this is part of what makes children so vulnerable. I want you to take a minute. This is just an 8-minute video, so it's not very long. It's a YouTube clip. It's from several years ago, but I think it's pretty salient and pretty important to take a look at. It's Dave Pelzer, who has written several books, most notably A Child Named It. And his resilience is absolutely amazing. This was the best clip I could find, so it's not the greatest, but it was the best one I could find. And one of the things that I would like us to talk about when we meet for discussion is what made him so resilient, and how does someone survive such a thing as his experience? So let's take a look at that and then come on back. So again, 8 minutes and we should be good. Okay, in terms of, whoops, I'm a little confused because I have 2 different sets of notes here today. I'm going to leave those ones aside. In terms of history and family context, for healthy development, children need an environment that is both demanding and responsive. And the tricky part about that is there's no one right way to provide this. And in fact, in families that have multiple children, each child may need a slightly different environment in terms of demandingness and responsiveness. So that can be really tricky. From a historical perspective, children were the property of their fathers, and parents could choose how to deal with them. So If parents wanted to beat their kids senseless, that was their right. Today, of course, thankfully, that is not the case. If we find out that a parent is beating their child senseless, that child is typically removed from the parent's home. The parents will also face some legal consequences, rightfully so. But, you know, we've come a long way, because like 200 years ago, which really isn't that long in the giant scheme of things, parents could do whatever the heck they wanted. And parents could basically just continue having children in order to have farm workers, because a lot of times, again, when we lived in a more agrarian society, you needed many hands to get the work done. We didn't have the type of machinery we have today. If parents wanted to send their 6-year-old to go work in the coal mine, they could do that. If they wanted to send them to go work in the factory, they could do that. They could take all their money. Now, of course, children are legally obligated to be attending school. Parents are obligated to get their children to school somehow. There are child labor laws, so we have a lot of protections now, but keep in mind, these are only like in the last 200 or so years, okay? And then again, there's no one right way to help children develop in a healthy way. What I often tell people when they ask me about, you know, like, well, but how do you do this as a parent? And I'm like, go to Indigo, go to the parenting section. There's hundreds of books. And the reason there are hundreds of books is because there is no one right way to parent. And even if you were like, well, specifically, how do I parent a child with ADHD? Well, there's 27 books about that. I'm making these numbers up. I didn't actually go into Indigo and count. So how do you parent? Well, you figure it out. Sometimes it's trial and error. So you might pick up the first book about, you know, your child with ADHD, how dietary modification reduces hyperactivity. And you're like, okay, I like the sound of that. And so you try it and you realize that did nothing. Okay, back to the drawing board. Did you hurt your child by modifying their diet? No. Did you maybe frustrate yourself because it wasn't working? Sure. But you go back and you try another book or another plan. So again, I want to just be incredibly clear. There are many, many different ways to achieve this end of healthy development. What I want you to think about now, though, for the first reflection question, is what is one thing you think healthy families do, and one thing you think healthy that should say healthy, not health families, whatever, healthy families don't do. Okay, and I know what you're thinking is, Carrie, that's like a really tough question. Yeah, I know. They're not meant to be easy. They're not all gimmies. Some of them are. Some of them I really want you to think a little bit. So coming back, thinking a little bit of this idea of continuum of care. So we sort of get to this thinking about Maslow's hierarchy of needs. And we can apply that to children and recognize that they need basics in order to then advance and thrive, right? So Maslow's hierarchy of needs tells us that we need to have our basic security needs met before we can advance. And we can't reach self-actualization, which is the pinnacle, if lower level things are missing. And same basic idea with children. Okay, so this comes out of your textbook, page 404 of the 6th edition, page 406 of the 7th edition. Okay, it's a slightly different graphic, but the same general idea. And so we see over here, you know, positive, healthy parenting style. We see a poor or dysfunctional parenting style. And then we see an emotionally abusive or neglectful parenting style. And it tells us different things like stimulation and emotional expressions, interactions, consistency and predictability, rules and limits, disciplinary practices, and emotional delivery and tone. And so as we look at this, we can see, and I'm just going to take interactions as an example, the first one for each one. So in a positive or healthy parenting style, we see that the parents engage in competent, child-centered interactions to encourage development. Okay? So that could be things like reading to your child, encouraging your child to be creative, so giving them markers and paper, letting them color, letting them do whatever they want, in that sense, right? Not do whatever they want all over the place. But going out and playing with them at the park, or kicking a ball around the backyard, or tossing a ball around, all things that impact their development, right, in different ways. From a poor or dysfunctional perspective, it could be that the person is often insensitive to the child's needs or unfriendly. So it's Saturday, you have no plans for the day, you look at your kid, and your kid's like, I really, really want to play dress up. And you're like, yeah, no. We're going to do, math flashcards. And every time you get an answer wrong, I'm going to tell you wrong, right? So unfriendly, not helpful, not interacting with the child where they are. From an emotionally abusive or neglectful perspective, that interaction is going to be emotionally or physically rejecting the child's attention. So that's the parent who is so absorbed in their video game or their movie that they don't even pay attention to what their kid is doing. So again, we see a continuum. People don't necessarily fall into one category for everything. They can sort of also be on the borderlines, but just to give you an idea that there are different ways of responding, some which are better, some which are marginal, and some which put us into that potentially abusive and neglectful category. Okay. In terms of some of the defining features, some child stress and maltreatment falls under the other conditions that may be a focus of clinical attention. So again, that's a category in the DSM. So when someone is experiencing something that doesn't meet diagnostic criteria for one of the clinical disorders, but still requires some help, we would call that an other condition that may be a focus of clinical attention. So things like parents divorcing, and a child may struggle with that. Something like being the victim of abuse, but not having enough symptoms for it to be depression, anxiety, or PTSD as a result. Okay, so that's where some of these cases may fall. Obviously, for children who experience trauma and stress, there's an elevated risk of post-traumatic stress disorder. What we might also see with children sometimes are regressive and somatic symptoms. So when a child has been exposed to a trauma or something very stressful, we may see them regress to an earlier stage. So a child who maybe used to suck their thumb as like a toddler or a preschooler, they're now in grade 4 and they've just gone through something very stressful or very traumatic, they may start sucking their thumb again. We might have a child who had, was fully toilet trained, fully night trained, who's starting to wet the bed. Those are things we might see happening when a child is responding to stress. They're going back to something either that may have been comforting to them, so thumb sucking may have been very comforting. They may go back to an earlier behavior just because of the stress. They start to lose some control. Okay. Yes. How stress affects children. If the stress is not manageable, children will become or may become either hyper or hypo-responsive to stressors. So they may overreact to stressors or they may underreact to stressors, okay? So hyper is over, hypo is under. And so it changes their overall response ability and how they respond to things, which again, might not be a good thing. In terms of maltreatment, it's defined as any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm. Okay, and so you'll find that on page 408 of the 6th edition. You will find that on page 410 of the 7th edition. Okay. And that comes from the Child Welfare Information Gateway, just to be all sorts of technical. When we're talking about maltreatment in Alberta, there is a mandated reporter law, as there is in almost every jurisdiction. So that means that people in certain professions and in certain roles, if they suspect or if they are told about the maltreatment of a child, they are legally obligated to report it. Oftentimes students have questions about, so what happens when you report it? And the answer is sometimes absolutely nothing. I have had to act as a mandated reporter in my capacity as a psychologist. So it hasn't happened to me in a university setting, in part as a professor, in part because I'm dealing with adults. So you guys, as adults, if you were to disclose something to me that something happened to you currently, which hopefully it hasn't, you're an adult and I am not obligated to report it. But when I was working clinically, I did have one report that I had to make because, well, my client was an adult and was reporting that her parents had engaged in some harsh physical punishment, which at that stage wouldn't have been an issue, except that she disclosed that she had a younger sister at home and who the parents were treating the same way, at which point I looked at her and I said, I'm going to need to stop you right here for a moment because I need to advise you that legally I have to report your parents' actions. And she was like, what? And I said, unfortunately, because you've told me that you have a younger sister at home and that your parents use the same harsh physical discipline, I am going to have to report it. And she was like, oh, holy crap, right? Like, 'cause to her, it wasn't that big a deal. And I explained to her, I said, you know, probably nothing will come of it. I said, but if your sister's teachers have made a similar report or someone else, then there's a chance that something will come of it. And at the time, I was living and working in New Hampshire, which is where this student went to school, but their home family was in a different state. So it was a little bit of a, okay, where do I call and report it? Because disclosure was made in New Hampshire, but it's actually happening somewhere else. And so I had to call this other state's, you know, reporting line. And I spoke to someone and I gave them as much, that's the other thing, you don't always have the full information. I gave them as much information as I had, and they then choose what to do with it. The choice that they made in that case was they decided that was not something that warranted investigation, but it's the type of thing that they keep on file, and if there were later other reports made, like so let's say the younger sister got to school with bruises one day, they might then go, yeah, okay, at this stage we have 2 reports on this same family, let's go investigate. Once you as a mandated reporter report, you're done. You are not involved in the investigation unless they choose to ask you more questions. You have nothing to do with what will happen in terms of any sanctions, discipline, legal action. But your job is to report. I also had to report twice when I worked at drug and alcohol rehab, when I had adolescent girls who disclosed that they had been raped. And actually, in one of the cases, the girl didn't say she had been raped. She was telling me about having sex with her drug dealer. And I was like, but you were 13. She's like, yeah. I'm like, that's statutory rape. She's like, what? I'm like, you legally were not able to consent to that, so I have to report it. She's like, you've got to be kidding me. I was like, no. I said, that's the law. Like, you have now disclosed to me an incidence of statutory rape. And she did not want it reported. She did not want to pursue it. And so I said to her, listen, I said, I am going to be as honest and as transparent with you as I can. I have to report it. You can choose to be in the room with me when I make the phone call so you can hear everything I say. You can choose to not be. You can choose to wait outside. You can choose to go back to whatever activity and I'll come get you after. You can choose to speak to, you know, the report. And she's like, okay, no, I want to stay in the room, but I don't want to speak. And I was like, okay. And so I had to call the state police because, again, it was in the same state but different jurisdiction, and that's who I called the child welfare reporting line. And they're like, no, this is a police issue. Call the police. And I actually had like a really amazing state trooper who took my call, and he was like, you know, she doesn't want to report. I said, nope. And he's like, she's not disclosing the person's name or whereabouts. I said, nope. And that was the thing, that she didn't tell me like, oh, it was John Smith who lives in Buffalo. It was like just my dealer, right? And that's all she said. And he's like, and the police officer said to me, he's like, okay. He said, so I've got a couple of choices here. He's like, I can come, show up at the facility in full uniform and sit down with this terrified 14-year-old who isn't going to say anything and waste her time and waste your time and waste my time. He said, or I can give her a couple of days. I was like, okay. And so he was like, when are you next in? And I was like, next week. He's like, okay, so let's make a plan to connect by phone next week. You'll tell me how she's doing and if she's changed her mind. Perfect. So I told her that, and the relief was palpable in the room, right? Because now it's like, this isn't going to be this big dramatic thing. And I said, so listen, you heard me report. If you don't want to give any additional information, if you don't want to pursue this, that's going to be your choice. The police don't have enough to go on to do anything with it. But take a couple of days, think about it, we'll check in next week. So the next week comes along, she's like, no, still don't want to. So I called the state trooper back and I'm like, she still doesn't want to talk. He said, okay. He said, then listen, here's what I'm going to do. I am still going to start a file in her name. I'm going to leave it open. If she changes her mind at any point in time, just tell her to call the state police and we'll take care of it. I was like, okay, great, thank you. That was rare. That was very, very, very rare to have a state police officer who was so understanding and so aware that him showing up to a drug and alcohol treatment facility in full uniform to take a statement or to try to force a statement out of someone who didn't want to give it was not going to go well. The other case that I had was someone who did say she was raped. She also had been underage, so it was statutory rape as well. She did want to report. She actually didn't know the person's name, but she had met him at their probation officer's office, so figured that he could be tracked. And so she actually, when I called to report in her case, the police did come to take her statement because she wanted to give her statement. So, but I still don't know what happened in the end. I don't know if they found the guy. I don't know if they charged the guy. I don't know. And that's what happens. When you're a mandated reporter, you make the report and then you're done. So psychologists are mandated reporters. Social workers are mandated reporters. Drug and alcohol counselors are mandated reporters. Teachers in schools are mandated reporters, right? If we learn about it, we have to act on it. But what happens next is completely out of our control, and we often don't even find out what the next thing is. Okay, that went on a little longer than I expected from what I thought was going to be a simple point. In Canada, about 14 out of every 1,000 children are maltreated. Neglect tends to be the biggest category of maltreatment that we see. So that's where we're going to head next, is talking a little bit about neglect. We have a couple of different types of neglect. We have physical neglect, which is a refusal or delay in seeking health care, expulsion from the home or refusal to allow a runaway to return home, abandonment, or inadequate supervision. So any of those constitute physical neglect. Educational neglect is allowing chronic truancy, so allowing a child to miss school, failure to enroll a child in school, failing to attend to a child's special educational needs. So if there's a child who does have developmental or cognitive delays, has a learning disability, and needs extra assistance, and you don't provide it, that is also considered educational neglect. And then finally, emotional neglect is marked inattention to the child's need for affection, refusal or failure to provide needed psychological care, spousal abuse in the child's presence, and permission for drug and alcohol use by the child. Those are all what are considered emotional neglect. And emotional neglect is oftentimes the hardest one to define. When you have parents who let their 16-year-old have a beer or a glass of wine when the legal drinking age is 18, is that emotional neglect? Is that maybe laissez-faire parenting, right? So there's going to be a lot of gray here. It's not very gray. If you don't enroll your child in school, that's pretty clear. And that is with the caveat of you're not providing actual homeschooling, right? Homeschooling is an option. But if you're homeschooling your child, you actually have to submit your plans, and your child has to be making progress and doing things that are age appropriate, grade level appropriate. So here we are at reflection question number 2. Given the 3 types of neglect just described, which do you think would be the most damaging to a child, and why? All right, so yes, that was another tough question. I know, but that's kind of the point here, guys. So continuing down our maltreatment line, we're going to talk about abuse. And when we talk about abuse, we have, we'll start with physical and psychological or emotional abuse. Physical abuse, multiple acts of aggression that include punching, beating, kicking, biting, burning, shaking, or otherwise physically harming a child. I really want to hope I don't need to provide further explanation on that. Like, this is one of those things that I think is pretty cut and dry. The only thing I will say is it kind of bothers me, but a key part of this is multiple acts. I'm not saying that burning your kid as a one-off is okay. All right, I want to be really clear about that. But the but is there, that if your child is biting you and you as a parent are just at that breaking point and you want to teach them that they shouldn't bite by doing a light bite on them to say, no, I still don't agree with that. I don't. That doesn't jive with my own parenting philosophy. But I'm not going to run and say, oh, that's physical abuse. Certainly shaking a child, that's a big no-no, particularly babies. That's actually pretty much the main focus of those like birth and baby classes is like, no matter what, don't shake your baby. Just don't do it. There's no reason for doing that. That is very, very, very bad. So even a one-off of baby shaking, yeah, that's probably going to go ahead and meet that criteria of physical abuse. Plus, do you ever just shake once, right? Like, I'm trying to think of it like, so if I took my water bottle, does anybody ever just go, and that's it with a baby? No, it's like, come on, right? You want the child to stop doing whatever they're doing. That's abuse, not of the water bottle, of the baby. So again, the other thing is most people who engage in physical abuse don't do it as a one-off. It's a pattern. So we're likely to see multiple instances. Psychological or emotional abuse is repeated acts or omissions by the parents or caregivers that have caused or could cause serious behavioral, cognitive, emotional, or mental disorders. Okay. Verbal threats, put-downs, name-calling, that all goes to psychological or emotional abuse. I do want to just go back up for a second to physical abuse because I see that I wrote something down that I did not say, which was that most injuries are not intentional. They tend to be the result of over-discipline or severe physical punishment. Again, most parents don't become parents thinking, I want to see how badly I can screw up my kid. And they don't look at their child and think, you know, that perfect arm of yours really needs to be broken, right? Like, parents don't do things like that intentionally or on purpose, but they sometimes get carried away. It's one of the reasons why we've seen a real shift in what is permissible in terms of physical punishment. And so you will find that in a lot of places, they will say 1 or 2 open-handed swats to a child, so essentially like a very minimal spanking, is permissible. However, not if the parent is angry or out of control at the time that they're doing it, right? Because when we're angry, when we're emotional, when we're hot under the collar, are we really good at regulating and judging? Is that 1 or 2? Are those just swats or are those hits? Like, you know, we don't have meters at home to gauge how hard that was. And so the general thought is, just don't do it. Don't use physical punishment. There's no good reason for it. It doesn't teach kids anything. And it could lead to a slippery slope towards physical abuse. So again, though, parents don't set out planning on hurting their children. What we often hear in cases where a parent has hurt their child is that they got carried away. In the heat of the moment, they didn't quite realize what they were doing. Doesn't make it okay, doesn't mean they don't face consequences, But that is what they often will say. Now, we get into sexual abuse and exploitation. As I was saying before, there's often tremendous secrecy about it. The adult who is engaging in sexual activity, and again, it doesn't have to be penetrative sexual intercourse. It can be fondling, it can be oral sex, it can be penetration with objects. There's a bunch of different gross things that adults do to children, right? I'm just gonna put it at that. But there's often tremendous secrecy about it. This is our special secret. This is something that other people wouldn't understand, so you can't tell them. There's oftentimes threats. If you tell, I'm gonna hurt one of your parents, or I'm gonna hurt you. And so that's how this remains secret. And what we're talking about in terms of sexual abuse includes fondling a child's genitals, intercourse with a child, rape, incest, sodomy, exhibitionism, and commercial exploitation through prostitution or the production of pornographic materials. Any of those things are sexual abuse. Any of those things are problematic. Are there shades of gray? Not a whole lot. We're very clear that below a certain age, children are not legally capable of consenting. Therefore, if you touch them, it is statutory rape. End of story. There's no gray. Where we get gray is when we have kids, teenagers, who are dating, and maybe when they start dating, they're 14 and 17, and maybe they continue dating, and the girl is now 15, and the guy is now 18, and maybe they started having sex when they were 14 and 17, but now that she's 15 and he's 18, now we're in a bit of a gray area as to whether it's okay. Subtract a year on the girl on that. Let's say they start dating at 13 and 17, and now she's 14 and he's 18. He can get in trouble, big trouble, because he's over 18 and she's 14. So that's where I think we start seeing a little bit of gray, and I think prior history would certainly be a factor there. But if the girl's parents really weren't happy about this relationship, they can now have that boy charged with statutory rape. And it's happened. Okay, there was a case, the university that I used to work at in the US, there was another university one town over, where there were some girls who were hanging out outside of a dorm smoking cigarettes. And of course, the legal age to purchase cigarettes there at the time was 18. They're on a university campus, hanging outside of a dorm. And so these two guys who lived in the dorm were coming back to the dorm, saw these girls hanging out, smoking cigarettes, said like, hey, you want to come back up to our room? The girls were like, yeah. They ended up having sex with the girls who turned out to be 14. They were charged with rape. The problem is, you know, they didn't ask the girls for ID. Like, who does, right? Like, so you meet someone, you're like, hey, you're really cute. I want to have sex with you. Can I just see your photo ID, please? And actually, can I slide it under this light to make sure it's a valid, right? Like, who does that? And so in their defense, they said they were on a university campus and they were smoking cigarettes. Like, there was nothing about their behavior to suggest to us that they were underage, so we didn't ask. Lesson there is always ask, okay? Always ask. Yeah, I feel like we've gone dark. Okay. When a child is sexually abused, their behavior and their development are also often impacted, as well as their health. So sometimes we discover that a girl or a boy has been sexually abused because they have an STD, because the loving whoever abused them passed on chlamydia or gonorrhea. And so we discover it that way. So there can be actual impacts to their health. And again, that's not the type of thing that, like, family doctors don't routinely screen 13-year-olds for chlamydia, right? Like, it's just not part of what goes on. Now, the good news, if there's any good news here, is that many of the kids who are abused will recover within about 12 to 18 months. So the physical effects, any delays or any impact on behavior and development will likely resolve itself within about a year, year and a half. But we are also likely to see some regression to earlier behaviors, which I already mentioned, and also some acting out behavior. In terms of characteristics of children who suffer maltreatment, child maltreatment affects boys and girls equally. The exception, of course, being sexual abuse. 80% of reported victims are girls. Children with disabilities are 3 times more likely to be victims of physical or sexual abuse. Now, the physical abuse sadly doesn't surprise me. Caregivers are overtaxed. They don't have the support they need. Having a child with a disability means that things become more challenging for a host of reasons. And I could see them physically lashing out, having a much shorter fuse. I'm not saying it's okay. I'm not saying it's a good thing to do, but I could see how that happens. The sexual abuse of children with disabilities is a little bit surprising, except for the element of these are children who may not disclose. So they become in some ways a safer target for a predator. Anybody who engages in sexual abuse of a minor is a predator, plain and simple. Like, there's no discussion there as far as I'm concerned. That's who they are. You could bring that up in discussion if you want, but I'm still going to stand by that point. Okay, in terms of thinking about the family a little bit, excuse me. Physical abuse and neglect often occur during stressful transitions. They're termed relational disorders when that happens. And we're talking about the transitions. We're talking about like when a child goes from infancy to becoming more active. You know, infants they don't really need a lot. They need a place to sleep. They need to be fed. They need to be held. But they're not that demanding. Like when I think about how much easier it was for me to sit down and read a book when my daughter was 3 months old, as opposed to sitting down and reading a book when she was 2.5 years old, oh dear God. Like a book for me, not reading to her, right? Like she was just a lump at 3 months old, more or less. Cute lump, but a lump nonetheless. And when I put her down for a nap, I was assured that she would sleep. That was no longer the case when she was 2. I could put her down for a nap, and one time, this is actually really funny, I went into her room to check on her after I finally heard her settle down and fall asleep, and she had gotten herself completely naked and put her clothes on one of her stuffies. And I was like, what? As an infant, she couldn't do that. She didn't have the dexterity to do that. So there was never a guarantee that, you know, it would be quiet, that I could get some work done, or that I could read or do anything. So those transitions, sometimes parents aren't ready for them. Sometimes parents find that's really stressful. That might be a time they're more likely to either neglect or abuse their child. The early childhood and early adolescent oppositional periods. So as children are sort of in that toddler to preschool age, when their favorite word is no, when they're starting to assert their independence, they're trying to discover who they are, that can be really trying for parents. And same with early adolescence, where there's a lot of boundary testing, a lot of limit testing, a lot of rule breaking. I know one of the most common things that I say to my daughter when she's in one of those limit testing places is I say, listen, you're doing your job really well, but I have to do mine. And she's like, what? And I said, my job is to set boundaries and make rules. Your job is to test boundaries and push rules. So you're doing your job really well right now because you're really pushing. I said, but I'm going to do my job really well, and I'm going to enforce those boundaries. And she's like, oh man. But that's what happens, right? And so sometimes when the kids push and push and push, you just lose it. And sometimes you just yell at them and it's a one-off and they stop what they're doing. Sometimes you get physical. Sometimes you walk away and you're like, forget it. Figure it out on your own. And it becomes neglect. There is rarely one contributing factor, only one contributing factor to abuse and neglect. So it's really hard for us to say, if this happens, you're more likely to abuse or neglect your child. There's usually a combination of factors there's usually multiple things going on. You could have a child who's just a particularly difficult child. You could have a child who isn't usually difficult, who's entering a difficult phase at the same time that you're dealing with stress at work and aging parents and maybe a mortgage payment that's coming due that you don't quite have enough money to pay. And your child acting out is like the last thing you can deal with right now. So it's not just one thing that we can look out for. Parents get stressed, kids get stressed, bad things happen when that interacts. 80% of victims suffer maltreatment from one or both parents. So parents are really often the driver here. About 90% of neglect is by mom. Mom is often the primary caregiver. Mom burns out. Mom can't. And so again, we're talking neglect. We're not talking about, physical abuse at this stage, but still. 90% of sexual abuse is by males, which is why I was using the example of like an uncle or another male relative. 50% of the time, it's a father or father figure engaging in sexual abuse with their child. I know, it's just sobering, right? Like there's nothing more I can say about that. In terms of causes of maltreatment, for adult offenders, some abuse and neglect comes from parents or caregivers' lack of knowledge about children and how to parent. So sometimes it is not willful. It is just, I don't know how to do this any better. This is how I was parented. Or I wasn't really well parented, so I'm trying here, but I just don't know what I'm doing. Sexual offenders have no one course, but they often are exploiting a child's vulnerabilities. Okay, and that's why we might see that slightly higher rate in children with disabilities because they're less able to speak up for themselves, they're less able to defend themselves. In terms of child and family influences, children may learn that their misbehavior elicits attention. And even though it's a negative reaction, it's still attention which becomes reinforcing. And this is a really hard one for a lot of parents and teachers to grasp. So again, we're now in this era of, a lot of people are working from home a lot of the time. From, March when schools and daycares and other childcare centers shut down, parents suddenly were thrust into working from home and having to provide childcare. And so it's entirely possible that a parent would say something like, okay, listen, like if the door is closed to the office, unless you're bleeding, I don't want you coming in and disturbing me, right? Like I'm on a work call or I'm doing something really important for work. But the child is like, well, this sucks, right? Like, I'm home, I'm used to being around other people, I need something to do. And so they waltz on into the office and the parent is like, hey, are you bleeding? No, back out. And the child's like, okay. And they're like, but mom still just paid attention to me, right? She yelled at me, she wasn't happy, but she still paid attention to me. And I'm kind of bored and I kind of need some attention. So once again, they walk into the office and mom's like, are you bleeding now? You're like, no, still not bleeding, but I kind of want a snack. A snack isn't important right now. I'm on a work call. Well, you're always on a fucking work call. Children don't say that, right? They leave out the profanity. So now child is like, okay, screw it. They go in again, and mother's like, get out, smacks her kid, right? It's like, no, not a good idea. But the child is like, okay, yeah, I just got smacked, but at least mom's paying attention to me now, right? She's off that call because she didn't want to see people smacking me, see her smacking me. It's like, okay. Children don't always discriminate between good attention and bad attention. To them, attention is attention is attention, which is why we recommend from a behavioral perspective, in order to extinguish the behavior, you have to ignore. And we know there's usually going to be a spike in the behavior, and then eventually it'll start to go away. But that's really hard. So a teacher in a classroom who has little Johnny who's constantly out of his seat or calling out answers, and she's like, well, if I ignore him, and then that spikes, it's so disruptive to everyone else. So she's like, Johnny, just sit down already. But Johnny's like, hey, teacher knows my name, right? He's still getting attention even though it's not good attention. so he will continue acting out. So that's a factor. What also can sometimes happen in terms of a cause of maltreatment is that the child gets caught in the crosshairs of conflict between the parents. So the parents are fighting, the parents are treating each other terribly, the child just gets caught up in the middle of it. So the parents are angry at each other and then end up yelling at the child. And then there's also social and cultural dimensions to consider. Acceptable child rearing and discipline practices vary with culture. And so this can sometimes get a little bit tricky because there is, of course, a school of thought of, well, if you're in Canada now, you have to adhere to Canadian law and Canadian customs, but it's like nobody hands you a book and is like, these are all the things your child may try to do, and these are all the ways in which you cannot react. There are some general principles that you are made aware of, but ultimately, when people are stressed, they often go back to what they know or what was done to them. And of course, some parenting practices are no longer that acceptable today. I know, I can think of when I was a kid, it was a relatively common threat from parents and grandparents that if you swore they were going to wash your mouth out with soap. You don't hear that one as much today. You hear it every now and then, but it's not something that is as common. I have friends who knew which wooden spoon they didn't want to see their grandmother holding because that meant that they were about to get, whapped. My child thinks of wooden spoons as cooking utensils because that's the only context she has for what a wooden spoon is used for. So again, there are going to be some cultural differences. There are going to be some differences in what people find is acceptable. Again, that case where I had mentioned I was a mandated reporter with the out-of-state thing with the younger sister at home, it was exactly that. What the adult child reported was that mom sometimes hit them with a wooden spoon. She was from a European country where that was standard discipline when she was a kid, and she continued that. But again, in these times in the US, that's not acceptable parenting or discipline. Okay, so we're going to now head into the disorders a little bit. We're going to start with reactive attachment disorder, which is characterized by a pattern of disturbed and developmentally inappropriate attachment behaviors. And this tends to be related to social neglect. Okay, so and the diagnostic criteria are on page 419 of the 6th edition, page 421 of the 7th edition. And so what we see in reactive attachment disorder is the child rarely or minimally seeks comfort when they're distressed, and they rarely or minimally respond to comfort when they're distressed. So they don't seek out comfort, and if comfort is offered, they don't react to it. They also have minimal social and emotional responsiveness to others, limited positive affect, and episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions with adult caregivers. The child has experienced a pattern of extremes of insufficient care, as evidenced by social neglect or deprivation in the form of persistent lack of having basic emotional needs for comfort, stimulation, and affection met by caregiving adults, repeated changes of primary caregivers that limit opportunities to form stable attachments, and rearing in unusual settings that severely limit opportunities to form selective attachments. So we see that the child's need to be attached and to have that secure attachment is not being met at all. And so as a result, they just shy away from comfort, they shy away from caregivers, and they don't have that feeling of safety and security from a caregiver. Disinhibited social engagement disorder is another possible outcome of social neglect. Oh, okay, I just didn't put that in. I should have. There, okay. So it's characterized by a pattern of overly familiar and culturally inappropriate behavior with relative strangers. Okay, so this is when a child basically is like, hey, I've never seen you before, but I'm going to come give you a hug because you're an adult and you look friendly. That shouldn't be what happens, right? Like, children should not just be going up to random adults, giving them a hug. And so again, we do want to think about whether, like, what's going on for that child, and consider things. I know I was at an MRU hockey game with my daughter. She's actually really sad that there's no hockey this season to go to. But there was an adolescent who clearly had some sort of developmental disability and delay. And she just came over and started talking to me and my daughter like as if she had known us forever, and was like, oh, you know, your gloves are really cool. Where did you get them? Can I try them on? Like, can I give you a hug? And it's like, okay, no. But again, because there was another issue that was clearly there, we wouldn't go with disinhibited social engagement disorder, but someone else without a cognitive delay or without a developmental disability engaging in that type of behavior, we'd be like, whoa, what's that all about, right? So again, focus here is the disinhibited part. These children just are like, hey, love me, care for me, to anybody. And so again, as I said, related to social neglect, diagnostic criteria, page 419 in the 6th edition, 421 in the 7th. Post-traumatic stress disorder. So I had mentioned earlier this was really sort of the heavy hitter, if you will, of the disorders in this area. And it's characterized by the display of persistent anxiety following an overwhelming traumatic event that occurs outside the range of usual human experience. Okay. Diagnostic criteria are page 422, 423 in the 6th edition, 424, 425 in the 7th. So again, just to give you that visual on what we're talking about in terms of diagnostic criteria, there's a lot going on here. So I'm going to talk about the 4 main symptoms though. Symptoms of intrusions, so things like flashbacks, avoidance of distressing memories, distortions in thoughts or feelings associated with the event, symptoms of extreme arousal or reactivity, or what we often would refer to as hypervigilance. So really being on alert all the time, noticing everything that's going on in the environment. It's a constant activation of the sympathetic nervous system. It's really quite difficult. Now again, following an overwhelming traumatic event that occurs outside the range of usual human experience. So being in a plane crash, that's outside of the range of usual human experience. Being in some types of car accidents. So there are some types of car accidents that likely would not trigger PTSD, including minor fender benders, single vehicle or 2 vehicle crashes that happen. But every winter we hear about like some 35 car pileup on the Deerfoot in whiteout conditions. And if you're in one of those and you're trapped in your car for hours because it's taking them that long to get to you because you're in the middle and there's a car on fire at the front and there's a car on fire at the back and there's dead bodies and you see limbs of people who've been dismembered. Okay, that goes into, that could cause PTSD, okay? So we do have to remember that there are some experiences that are really not, like 35 car pileup with cars on fire and dismembered body parts. On the Deerfoot, that's sort of outside of the range of the usual human experience, even though it happens every winter on the Deerfoot. Maybe not the maimed part, the dismembered body parts, but the 35 car pileup typically happens, or something in that range. So again, we think about this. Someone, jokingly threatening you with like a plastic knife who's coming at you like, I'm gonna kill you. Like, no, they're not really. Someone coming at you with a machete saying, I'm gonna kill you. Yeah, okay, that's outside the range of the usual human experience. So that's what we're using here. And we also are really looking to see that there was an actual threat of violence or harm, possibility of death or severe injury. And then if you experience that, you may get PTSD. Acute stress disorder is very similar. The big difference between acute stress disorder and post-traumatic stress disorder is that acute stress disorder is diagnosed if the symptoms develop within the first month following the exposure to the traumatic stressor. Now you might be thinking, well, wouldn't you start having symptoms right away after exposure to a traumatic stressor? And the answer is oftentimes no. And that's why PTSD exists, because oftentimes when we've been exposed to a traumatic stressor, we're in shock for a little bit. And when we're in shock, we're not processing all of the whatever happened. We might also have physical ailments as a result of what happened that need attention. So if you were in that really bad car accident and you needed the jaws of life to cut you out of your car, there's a significant chance you might have injuries, right? You may be hospitalized, or you might need to be at home recovering. And then and there, your focus is on healing your body first. Your brain sort of says, yeah, let's focus on getting the body all better. And then, as you're starting to feel better again, as you're contemplating getting in a car and driving, your brain goes, oh, now is the time to remind you how you almost died. Now's the time to make you crazy. And that's post-traumatic stress disorder. But we do recognize that some people will start experiencing symptoms sooner. And again, we're not going to say like, oh, it's only been 27 days since you almost died. You got to wait a few more days for a diagnosis. So we have acute stress disorder to account for people who start showing symptoms sooner rather than later. And then we have adjustment disorder, which is diagnosed when a child or adolescent has an atypical reaction to a more common stressor. So you may remember at the beginning of this lecture, I talked about the difference between a traumatic event and a stressful event. So adjustment disorder is the diagnosis that we have to account for when people are struggling with stressful events. So major life transitions, starting university, right? Well, that wouldn't be a child at that point. Questionable whether you're adults or adolescents. I like to think of you as adults, but kind of adolescent-y. But think about a child whose family has just moved across the country because of their parents' job, and they have had to give up all their friends, all their activities, their school that they're familiar with, and they have to start in a new school, meet new people, and they're struggling with that. And we would expect them to have some difficulty with it, but maybe we have a child who is like struggling more than a typical child would struggle in that situation, right? Maybe they're having a lot of trouble sleeping. Maybe they're having a lot of somatic symptoms and it's not getting better after a little bit of time. That's when we look at a diagnosis like adjustment disorder. So it's to recognize that children and adolescents, and adults for that matter, sometimes struggle with stress. And sometimes it becomes distressing and it causes impairment, and it's a bigger reaction than what would typically be expected under similar circumstances for other people. And that's okay. So we have a code for that, and we have a name for that. And oftentimes adjustment disorder, people with adjustment disorder will respond to treatment pretty quickly. It's usually brief therapy does the trick. Okay, this takes us to reflection question number 3. How can PTSD be avoided? So think about that for a moment. How can a person avoid getting PTSD? Okay, so a little bit more about PTSD now that you've thought about how you can avoid getting PTSD. I'm not going to answer that now. I'm going to wait and answer that when we meet in discussion, because for some of you who may look at the reflection question and go, I'll listen to the rest of the lecture and then go back and answer it, I don't want to give you the answer. So what are some associated problems and adult outcomes that can happen? Well, probably not surprising to you, mood and affect disturbances can be quite common. So depression, we might see adolescents in particular, sometimes even children, engage in self-mutilation or self-harm. We see more suicidal ideation. We see an increased use of substances, so increased likelihood of a substance use disorder. We also will sometimes see eating disorders. develop in people, in children and adolescents who have experienced PTSD. Emotional and behavior problems. So for girls in particular, we're going to see some self-blame and some shame. For boys, we're going to see an increase in physical and verbal aggression. Okay, probably not terribly surprising. We're also going to see some sexual adjustment in that the child or adolescent may show age-inappropriate sexual interest or activity. That is going to be more likely in younger children. So again, particularly those who have PTSD as a result of sexual abuse. So we're going to see that in younger girls, and then we're going to see a re-emergence of that in adolescents. So if you're ever working with a girl, like a younger girl in a therapeutic or some other context, whether it's school, whether it's who knows what, and she's displaying inappropriate sexual behavior, chances are she has been sexually abused. That's often a sign that we say to look for. And then, of course, in adolescence, it's a little bit trickier to detect because some people do start engaging in sexual activity at a younger age just because they're interested, just because that works for them. But certainly in younger children, when we see some inappropriate sexual interest and activity, it's often because they have been sexually abused. And then we're also likely to see, in terms of associated problems and adult outcomes, as they merge into adolescence and adulthood, some really unhealthy relationships with a higher likelihood of partner violence. Okay, in terms of causes, what causes PTSD? Well, quite simply, the answer here is trauma, exposure to trauma. Without trauma, you're not going to develop PTSD. But some of the other contributing factors, because not everybody who experiences a severe trauma develops PTSD, are things like poor emotion regulation. So making it hard to know if you're okay. So a person tends to be pretty on alert. They can also be somewhat inhibited. So they just have a hard time regulating their emotion and knowing if a situation is a threat or not. The emerging view of self and others. So again, remember, children and adolescents are figuring out themselves and their world. And so if they don't have positive core self-beliefs, if they have a decreased sense of self-esteem, if they tend to blame themselves, they are more likely to develop PTSD following exposure to a trauma. And then also some neurobiological changes. We see changes in brain development from chronic stress. So if a child has been, or an adolescent has been chronically stressed and then encounters a trauma, we are more likely to see the development of PTSD. In terms of treatment, exposure-based therapy is going to be a big part of it. Exposure is really, really helpful when it comes to PTSD. So trauma-focused cognitive behavioral therapy is the most studied and supported form of exposure therapy for childhood trauma or stress. And essentially, this is a combination of exposure and skill building. So we're going to, of course, expose to the trauma, and again, in a safe manner. I'm not going to ask a child who was strapped into their car seat in a horrible car accident to have their parents recreate the car accident, so that they can be exposed to it. Instead, we're going to talk about what it felt like to be restrained in a situation when they felt like they needed to escape. We might mimic that. We might ask the parents to bring the car seat into therapy, so into the therapist's office, out of the car, and have the child sit strapped in to re-expose them to those feelings of being strapped in and what that was like. And then also skill building in terms of relaxation exercises, in terms of whatever else might be missing. Thinking about how to interpret symptoms, maybe even learning how to engage with a friend when they're feeling stressed about things. In terms of some of the special needs of maltreated children, when we're talking about physical abuse and neglect, We often will include parent training as part of our treatment. Parents, it's not the child's fault that they have been abused or neglected, especially if it's the parents engaging in it. So we do need to work on the parents and their parenting skills. And then with, excuse me, sexual abuse, cognitive behavioral therapy, and again, this trauma-focused cognitive behavioral therapy can be particularly helpful. And that concludes trauma.